In our last Obamacare story, for now, early enrollment reports suggest that the healthcare law hasn't exactly pulled the interest of America's young people, a problem that could prove to be detrimental to the success of the legislation. Insurance agencies have warned us that without young, healthy enrollees, the insurance policies available in the exchanges will likely become too expensive. But as of now, the number of young people signing up for Obamacare is not looking good. Sabrina, we know how important young people are to the risk pool. Why haven't more of them signed up for affordable care?
Well, it is certainly very concerning that not only are the overall numbers much lower than projected, just over 100,000 as opposed to 500,000, which is what the administration hoped for, but that the majority of them are elder people who desperately needed health care coverage or are suffering, of course, from various illnesses for which they need to be covered. With respect to young people, one of the main problems is, of course, that they don't have a fully functioning website. The primary way that young people would sign up is by going to healthcare.gov and seeing what their options are, comparing different plans. The site hasn't been reliable as a source to do that. They're a lot less likely to pick up the phone. And of course, the phone, too, many have pointed out, Jeffrey Young here at Huffington Post had a story on how that's not exactly the best way because you can't really shop around for the premiums the way you could online if the site were working. In addition, we have to kind of see young people are known to procrastinate, so they could very well push it to the deadline. And then, of course, because their premiums, some of their premiums might be higher, so because they are, of course, offsetting the cost for the elder and more sickly, some people might be calculating that it is better to just pay the fine and not have health insurance, of course.
And now there's another layer to this, Sabrina, which is that President Obama has extended, even if we just go with Obama's administrative response, not a legislative response like Upton's, President Obama has given young people the opportunity to stay on their plans, which might not be great in terms of the coverage they offer, but they might be cheaper. They might not be providing all the provisions they need, but if you're a young person, if you're 26 years old and healthy, you might be fine with your small group or individual plan that only costs you $100 a month or $150 a month. So now young people have another reason not to opt into Obamacare.
Exactly. I think the fact that what the administration had deemed junk plans are still going to be available under this fix to people who are already enrolled in them, simply because of this issue of cancellation notices and not being able to access healthcare.gov reliably. That is something that some young people might be taking into account. There's also the issue of the fact that a lot of people under the age of 26 can stay under their parents' plan. That was a big part of this law, so it isn't entirely clear if some of those people might be unemployed or have better coverage through their parents' employer-sponsored healthcare plans. So there are a lot of facets to this, and of course there are campaigns on both sides. On the side of the pro-Obamacare groups, there are a lot of campaigns encouraging young people to sign up. On the flip side, Republicans and conservatives are also spending millions on advertising and tailgate parties and all kinds of things to encourage young people not to sign up. So some of that also factors in. Maybe some of them are listening more to the ads that are saying Obamacare is terrible and you don't need health insurance. Just stay healthy and don't get sick. That doesn't tell the whole story about emergency room coverage and stuff they might need and not be aware of. But advertising also works.